happy to be here. I'm Rob Luchsinger. I have been going to Blackhawk for a long time and have been here at the Fitchburg site since we moved back here about 5 years ago after I finished up training. I wanted to talk to you guys today about a topic that I see very frequently as I take care of women and families, which is peripartum, meaning depression, anxiety during pregnancy or that starts after pregnancy. This is a really common thing that I see, and it's something that affects women in all different ways and can be all reaching different parts of their life. So I thought it'd be a good topic for you guys here. So as they're talking about, I grew up in southeast Wisconsin. Elkhorn, Wisconsin is my hometown, not down near Lake Geneva. And I came up here to UW for undergrad. I then went out to Western University of Health Sciences, which is a DO school out in the state of Oregon for my med school. Came back and did my residency training, 3 years of specialty care and in family practice at the Mayo Clinic in La Crosse. And then moved here, and I'm now working for one of the local health organizations here and deliver babies in America. So it's a fun practice. I get to work with a lot of young families, and it's an absolute joy to take care of that population. My wife Abby is right in the audience here. Let's give a help. She loves this, so I do this every time. So, and got 4 kids, almost 10, all the way down to 4. And so sometimes I put aside the stethoscope and talk like, okay, what supplies do you need in clinic and stuff like that too. Do I really need that diaper warmer? Postpartum depression, anxiety looks a lot of different ways. I'm just going to say some stories of things that I've seen. Maybe they resonate with you because they connect in different ways. Maybe you're that first time mom. You brought your baby home. You're now 2 weeks into parenting. You're fully realizing you have no idea what you're doing. Your baby is crying. It's 3 in the morning. Everything hurts in your body. You never even knew that some places could hurt as much as they do right now. Your mom's gone home. No family in the area. Friends are nice. They're bringing by stuff, but like you just feel disconnected. You feel down. You feel like this is never ending, and how am I going to do this for 18 years? And I already thought I was going to have 2 more kids on top of this, so holy cow, what have I gotten myself into? Perhaps you're that second or third time mom. You got 2 kids at home already. They're running around like little hooligans. Lovely, beautiful little hooligans that you love so much. But they're not on the same nap schedule. And you're more exhausted than you were with your first one, and you wonder, how did I have it so good with the first one? I didn't even realize it. You're stressed. You got pre-K to figure out. You've got those forms to fill out for school, that immunization report. Oh shoot, I forgot to schedule that doctor's appointment that now I'm not going to be able to do for another month and a half because my doctor's booked out so far. Everything seems like it's on your plate. Your partner is off at work now, and you just feel the dread of everything coming down. Maybe you're that mom who's now 11 weeks out and is looking at work coming back. You see that inbox, you open it up for the first time, and there's 1,000 emails inside there, and you have no idea how you're going to get caught up from your teammates who, bless their souls, were going to help you, but it just didn't get done the way that you wanted to. And now you're just like, how is this ever going to work? How am I going to make this work at home? Am I ever going to be able to enjoy my kids? Or maybe you've had a different route into parenting. Maybe you've been going through a fertility journey. It's been years, and now you have this beautiful little baby in front of you. You had so much expectation, and like, we're so excited to have this baby, and now you just feel stuck, and you have no idea how you're going to take care of this little one. Or perhaps you're that mom that you've been going through an adoption process, and you've been anticipating this day for so long, and now you've got the baby and you have no idea what you're doing there either. And everyone is saying, gosh, you should be so thankful. And you're like, I don't feel thankful. I don't feel joy. Peripartum depression and anxiety is anxiety or depression. We'll go through some of the symptoms in just a second. That occurs either during pregnancy or up to 12 months after delivery. Now, that definition has a lot of different nuances to it depending on the group that you ascribe to. In its broadest term, onset during pregnancy or up to 12 months after delivery. The big thing that separates it from the baby blues is that the symptoms are persistent for at least 2 weeks. It's really common to have that. In fact, almost every single woman will have kind of a mood that goes up and down for that first couple weeks after pregnancy because of hormones and a lot of other things. But what separates postpartum or peripartum depression and anxiety is that those symptoms are persistent. What does it look like? Depressive symptoms can include feeling sad, hopeless, worthless, guilty, or just flat. Like, I can't get excited. Or if someone were to say, gosh, I'm having a hard time with my own health, or my spouse lost their job, you'd be like, I don't care. Often you feel frustrated, anger, and/or hostility. Loss of interest or pleasure in things that you enjoy doing. I was looking forward to being able to go out and ski with my kids. Now I just take it or leave it. Change in appetite or weight, and that can either go up or down. Either you tend to be one that I just take comfort in my food, or I have no time to eat, I have no desire to eat. And often you can see fluctuations in weight. Use of alcohol, tobacco, or illicit drugs. I know that's not talked about in church settings that much, but it does happen. Sleep disturbance. Hard to tease out from how much you guys are losing sleep already, but now it's more of that I have desire to fall asleep and I can't, or I just have no desire to get out of bed. I have no desire to do anything. Fatigue, once again, also hard to tease out. Neurocognitive dysfunction. So that's kind of a broad term that means I'm having trouble focusing, I'm having trouble doing things that I need to get done, tasks aren't getting completed, or that things aren't just getting done as well as you wish that they would, with as much detail as you wish that they would. Sometimes people get thoughts of harming themselves or others. And very rarely, hallucinations can happen, or more serious things. Anxiety, the symptoms are very, they intertwine a lot. Anxiety and depression are sometimes really tough to tease apart from each other because they are so similar in how the biochemical pathways work as well as just how the symptoms work. Worry or fear that impacts your daily function, restlessness, decreased concentration, obsessions or compulsions, I need to go check on my baby. I know that they're safe in their crib and they're sleeping right now, but could there be a problem? Or obsessions I need to make sure my bottles are washed out. I need to make sure everything's lined up just right. I need to make sure the meals are all set. I need to make sure that the floor is clean. I want everything to be a certain way, and I feel distress if I don't. Poor sleep, irritability, feeling tense. And often that feeling tense goes into the somatic or the body aspect of things. And not only do you just feel mentally tense, but often people have physical manifestations of their mental health and they feel tense physically. Their shoulders hurt, their low back hurts, and it's because you're just like this all the time, mentally and physically. How often does it happen? 1 in 7 women. So look around your tables. Odds are is that at least one of you at your tables have dealt with this in your past. Now, if you look at the national statistics for depression and anxiety, they say that about 9% of people in America suffer from depression at any point in time. So just looking around the room, you guys can do the math as well too on who and how many people might be suffering from just anxiety or depression that's not tied to pregnancy. But that is a major risk factor for people who would develop postpartum or peripartum depression and anxiety. Who does it happen to? Anyone. The biggest thing that we see is that there's no specific risk factor and that it can happen to anybody. However, there are some things that can tie into having it more often. As I said, the greatest risk factor is depression and anxiety prior to pregnancy. There are some other risk factors: fear of childbirth, tobacco use, either at a very young age or at age over 40, being unmarried or having low social support. If income is not as great, or if you're having trouble making ends meet, that is a risk factor as well for postpartum depression and anxiety. Presence of domestic violence. If this was an unexpected pregnancy, having pregnancy complications such as gestational diabetes, or gestational hypertension, or preeclampsia afterwards as well too, when people are going through a lot of different issues, especially if now you're taking medications for blood pressure, or you're having to go to more doctor's visits or call your doctor on the phone. There's just a lot to manage and handle, and along with the fact that your baby wants to eat every 2 to 3 hours, and you need to take care of yourself. Colic is also something that can lead into that. I'm sure that everybody, or at least most people, has seen the video of the period of purple crying. Does that ring a bell to anybody? So purple crying is that colic of that having a peak of crying being that you're having more than 3 hours of crying per day that you can't do anything about. It won't go away. You try to rock, you try to go for walks, you try to go in the car, you try to feed, it doesn't stop. They look like they're in pain. And it may even happen when you're at your weakest, which is overnights and evenings. That's a huge risk factor as well. And it's just, it takes a lot of toll when you just are dealing with that noise that is so piercing into your soul. Why does it happen? It's a hard thing to say, and if you ever hear from a medical professional, it's a complicated issue, and there's no one thing that means that we kind of don't know, or it's a myriad of a lot of different things. What we think is that there's 3 things that tie into it the most from a biochemical thing. The first is estrogen levels. As you can see, the fluctuations of estrogen during your menstrual cycle are nothing in comparison to your estrogen level at the end of pregnancy. And then all of a sudden, the estrogen level takes a cliff dive afterwards. So with this huge biochemical shift, there's a strong tie to having changes in your mood with estrogen level changes. Furthermore, thyroid level changes can also play a role into this. The thyroid is as you guys probably know already, is kind of the master gland for metabolism. So if you're growing a human, that level needs to be a little bit higher as you're growing your human, and then after birth, that level drops off significantly. We think that might also be playing a role in it. And lastly, there's some things on genetic traits. We do see that people who have siblings or have had a parent that has suffered from postpartum or peripartum anxiety or depression, they often have a higher chance of having it as well. There are some new studies as well on epigenetics. That might be an unfamiliar term for people. That's expression of genes rather than what your genes actually are in the DNA. And there are some newer, smaller studies that say that there are some things on how people's genes are expressed that can change how peripartum depression helps. That's way beyond the scope of this talk, but just interesting things. What are its effects? As you guys probably know, it affects everything in your life. It affects your ability to have joy. But also it affects your ability to do things that are helpful for both your family as well as yourself. We see decreased rates of breastfeeding for women who want to and can breastfeed, or earlier cessation of breastfeeding in women who have been diagnosed with postpartum depression and anxiety. We see that people don't bond as well. They don't feel like they're just able to connect with their baby. They feel alone, and they just feel even that derealization where like the baby exists kind of somewhere in your mind, but like on the day-to-day life, like you just kind of want to ignore sometimes that that's even there, which sounds really tough and sounds like really awful, but it does happen. You see more marital discord. You often see habits that have been recommended not being adhered to as well. The big one being laying kids on their backs, as well as practicing safe sleep habits. I know that that's really hard, and a lot of women there are a lot of people that fall asleep with their baby on top of them. That's a discussion for another time. You don't see people laying kids down on their backs in a safe place as much when people suffer from depression and anxiety, and I get it. I understand it. You also see people not follow up for both their own appointments as well as their kids' appointments as much, as well as doing normal childhood cares. How is it treated? Treatment is kind of in two different domains, generally from a medical side. There's also some things that you can do for treatment outside of the medical realm, which I'll get into a little bit too. From a medical side, we split it kind of into things that are more therapy and then things that are more medication. And not all of them are indicated all of the time. I'm going to talk about therapy first because I do think that therapy is helpful for pretty universally. Therapy looks a couple different ways. The big one is individualized therapy. Individualized therapy is often what's covered the best by your insurance plans, and often they don't even need prior authorizations. You just need to contact your your local doctor or midwife or OBGYN and say, I'm struggling, and they can get you a referral in to see somebody. Now, the big struggle with that is access. I don't know how many of you guys have tried to see counselors or have friends who have tried to see counselors. The average wait time in America is about 4 months to see a counselor, and that's too long to help in the moment there. So scheduling appointments, whether they're video visits or whether they're in person with your physician or PA or NP, it can be very helpful to try to solve these issues sooner and work through any big risk factors that would get you into counseling sooner. Group counseling is also an option. Often group counseling is something that's a little bit easier to get into because they can have one therapist that works with many different people. It also offers an opportunity, kind of like what you guys have here today, to talk about what you're going through and hear other stories of what people have done to help, what they're going through, the things that work for them and the things that they're struggling with. So some people really struggle in a group setting with this because it's just really hard to open up about these very private things in your life. So I'm not going to say that one thing is preferred over another because it really is individualized based on your needs and your personality. But I think that both of these could be good options for people. Medication can also be very helpful. From my experience, medicine is not going to cure depression. I mean, looking at the genetics of things, depression is one of those conditions that can be very hard to cure and make go away. It's how can we help control it and keep rails on things so that way you can have good quality of life. And medication can be really helpful for that, whether it's calming down anxieties and keeping you from going off of that cliff, or kind of bringing up your mood and helping you be able to have energy and joy to do the things that you want to do. I think that a lot of people get scared of medicine because how is it going to affect my baby? All the medicines that we use are well studied. Thankfully, the biggest classes of medicines, SSRIs, selective serotonin reuptake inhibitors, or SNRIs, with norepinephrine substituting serotonin in those, they've been around for a really long time. They have a really long track record of safety, and your medical provider is going to not steer you wrong in getting you onto something that's going to be safe for you and your baby. Talking through side effects is really important because there can be some big side effects of these medicines. They can change your ability to have like those high highs and those low lows. For some people, it can really kill their sex drive. For other people, it can make it harder to feel like you're in that normal cycle. But all in all, depending on what your goals are with medicines, they can be a very, very helpful thing either controlling day-to-day symptoms or rescuing you from those moments where you just feel overwhelmed and you just need something to calm you down. Other things that can be helpful, because we think about in the wheel of wellness, how are you affected from an occupational, environmental, financial, spiritual, as well as physical and emotional support? I mean, that's where doctors spend a lot of time, is in physical and emotional, but we need to pay attention to these other things as well too. So having some lifestyle interventions can be helpful as well. That can include exercise. There's been big studies that have shown that regular exercise can be in select individuals just as effective as starting a medication. And in conjunction with therapy and medication, exercise and having a set exercise routine helps improve outcomes and people's control of their depression after delivery, as well as just in general life with generalized anxiety or major depressive disorders. Scheduling regular time for yourself outside of taking care of kids. Now I say scheduling on purpose because it doesn't get done unless it's scheduled. So I'm sure that you guys have all thought that gosh, like taking time for myself is not going to happen unless I schedule it. That can be really hard to do, and just to have that motivation to do when you feel like everything is just really, really hard right now, and I can't even do life, much less get up in the morning and schedule time for like my warm coffee and my morning trip into the Bible. Like that just is overwhelming. Sometimes even just doing simple things like getting up and scheduling, like, okay, I'm gonna take a walk after the kids are going to school, I'm just gonna go on a walk for a little while. Or I'm going to go and call a friend. I'm going to call my mom or my sister. Or if you want to talk to your husband, like that can be a difficult thing because often, I mean, we're dumb. I'm just going to say, guys are dumb, and we don't get it. We don't understand the hormonal changes because we don't have them. So I'm sorry for all of us out there. I'm sorry. But though you may not be able to do like this woman is and sit with your coffee and your shawl, I mean, looks wonderful. I wish that the medical profession and the insurance companies could be able to cover that prescription. Finding time to recharge in whatever way looks right to you in those moments, very important. The last thing is finding community. I'm really glad you guys are here. People who are socially isolated do poorly with anxiety and depression. If you notice that there's somebody around you who is getting more socially isolated, they're like kind of quietly quitting on plans, or it's like the text messages just aren't like getting responded to, or last minute thing came up. Maybe that last, especially if it's like, hey, excited to see you this morning. You know what, something came up, I'm not going to be able to make it today. Sometimes if you see that as a trend, it's worth sending a message, hey, how you doing? Or even like call it. So that can be, that's something that can be a subtle indicator of that there might be something bigger going on here. I think I have it, or I think I have a friend who has had it. What do I do? First of all, recognizing that step takes bravery. It takes introspection, and it's hard. I'm proud of you guys if you recognize that you have it. I'm proud of you for taking that time and taking care of yourself. And the fact that you're willing to recognize that you have it and admit to yourself that you're struggling with it, and then take that next step of admitting it to a medical professional, gosh, that's a huge step. I'm glad that you're there. Asking for help can look differently in different situations. I'm first going to talk about the most problematic situations where like, hey, I'm struggling so hard that I can't do things that I normally can do. I'm laying in bed all day. I'm so anxious that I can't even do anything. I don't want to take care of my baby. In fact, like I never thought that I would think this, but like I just want to shake my child, or I just want to like have everyone go to their rooms and stay there for like a week. Like if you are in that place where like you feel like you need help now, it's always there. 1-800-622-HELP, 24/7, 365. This is a CDC-sponsored Substance Abuse Mental Health Services Administration. There are always counselors on the other end of this. There are always someone there that can talk to you. Whether it's 3 a.m., whether it's 2 in the afternoon, whether you're calling with a friend, whether you're calling by yourself, there's always somebody there to be there in that moment of crisis. Most local health organizations, and I think all the big players here in Madison, have mental health crisis lines as well too. So if you call your clinic and say, I'm having a mental health crisis, there are people there to answer those phone calls that will be able to give you more in-depth resources locally, in addition to this number, which is good nationally. So if you have friends in other states that you think are struggling with this, that number is good for them. Don't have them call SSM Health or GHC or UW around here, because we're gonna be like, hey, you need to talk to your local provider. But these folks will be able to give them resources in their area. If you feel like you are going to hurt yourself or hurt other people, go to the emergency room. This is an emergency. Have someone drive you there. Go there yourself. Know that you might be there for a little while. Know that you're probably gonna have to tell your story about 3 times to different people, and I'm sorry about that. That's just how the medical system's built, and I wish that I could change that, because it's being on the other side of things, like that's really hard to have to tell that really intimate, detailed story in a place that really is hurting in that moment to people who you're complete strangers to. I'm sorry that has to happen, but know that we're doing it out of a place to get you resources and to be able to make things better. Call your doctor. If you are in kind of that middle range where it's like, this is really affecting my day-to-day life, I feel like there's a block here, I can't get that joy, I can't get the things done that I need to get done, I'm not feeling like I am going to be in imminent danger to myself or others, but this is like, I'm really overwhelmed by this. Call your doctor. And I say call because I want you to get prompt response. MyChart is a really great resource. However, most health organizations in the area have about a 72 to 96 hour turnaround on their MyCharts. So if you wanted to get prompt help, calling the clinic is always going to be your best thing. If it's a non-urgent thing of, hey, I think I've got this rash or something else going on, that's fine. MyChart's a great resource for that. We welcome MyCharts. But if it's something that you want dealt with within 24 hours, please call us. The nurses are always there to get you help, and they'll send stuff over to the providers that they can't help triage. Blackhawk Care Ministries also has resources here too. Most of the resources that are provided directly by Blackhawk, and I am not affiliated with Blackhawk, and I'm not speaking from a place of being affiliated with any of the organizations here in the area from a healthcare perspective. But there are resource pages through Blackhawk's website that you can look for counselors that come from a Christian background. There are spots that you can call, even in an emergency, to talk to a pastor. And there are places where you can get resources if you have tangible needs through the Mother-Child Resource Center or through other local area places. So please lean on Blackhawk or other churches in the area as well too, because we care about your physical health and your mental health, as well as your spiritual health. They're also tied together. I am always impressed by the strength of women. The stuff that you guys go through on a day-to-day basis, having to the societal pressures that you have, I just take my hat off. And I am always happy to partner with people and help them get resources that they need. Please reach out to your providers. We care for you guys. And please reach out to people here if you feel like you're in a spot where you need help. It's common, but that doesn't mean that it's normal. And we want you guys to feel fulfilled. I think there's a couple minutes for questions. Is that okay? Or would you like to move on to the panel?
Let's move on.
Okay, sounds great. So I'll cede it back over. I once again want to thank you guys for letting me come, and I appreciate your time, and I appreciate all the work that you guys do for your families.
Thank you so much, Dr. Brown, for being here and for that. If you guys are on the panel, come on up. We'll jump into that a little bit. Find a cozy seat.
Oh, sorry. Wait a second. I'm supposed to do something.
Alright. So, thank you, honey. That was great. I hope you guys all walked away with something new that you maybe didn't know before, or just learned a little deeper, new perspective. We have up in front now 4 women from our ministry who have all experienced either postpartum or peripartum anxiety or depression, and so we wanted to give them a chance to kind of share their stories a little bit, what it looked like, how it manifested in their life. And I had a whole list of questions, but I think we're just going to focus on kind of what their story was. And then I think it might have worked out that there's like one in each group, which I didn't plan, but that's brilliant. So when we go down, because we want to make sure we save some time for some more discussion too. So we're going to give them each a little bit of time up here just to share their stories, and then we will open it up for questions for a few minutes at the end for either Rob or any of the other women up here. But then we do want to make sure we get into our small group time. So some of the stuff that we would have asked up here, we have written down, and we can talk about that in small group too. So I'm just going to hand off the mic. I don't want to put anybody on the spot. Does anybody want to go first?
I'm afraid I was going to talk to you all, so I wanted to see how long you guys took first. So I'm Teresa. I have a 4.5-year-old and a 1-year-old, and I've been kind of through this twice with both pregnancies. So with my 4-year-old, we went through all kinds of infertility treatment to have her IVF eventually. And so I think when you finally have that baby you've been waiting for such a long time, you like expect that you're gonna be the happiest you've ever been. And I think that for the first few months I was doing okay. It was summertime. But as she got to be like 3 or 4, I started having symptoms that just seemed unusual. I was feeling worried about myself. I thought I was having all these symptoms. I thought I was dying. I was having heart palpitations. I was anxious about everything. I was worried she was I would look at her, I would check on her all the time. I was worried she was gonna pass away in her crib. I was constantly afraid I was gonna walk in and she would be dead. I was having these thoughts all the time. And so I went to see my doctor, and they thought, oh yes, this sounds like anxiety. Postpartum anxiety is very normal, blah, 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 blah. And it took a long time, but eventually they diagnosed me with hyperthyroidism. So it's important to get checked out, even if you think, well, it's just anxiety and I'll work through it on my own. For me, at that time, it was something contributing to it. So it took a while for my thyroidism to get treated, because generally it's self-limiting, it gets better on its own, but they had to treat me. So once my daughter was about 10 months old, my thyroid was under control, my anxiety kind of turned into more of like postpartum rage. I was having trouble where I wanted to control everything and couldn't. You realize as a parent, you can't really control many things. And it took it all out of my husband. So I was angry all the time, especially at him. He said, we need marital counseling, and I kind of said, actually, I need counseling. And I finally talked to my doctor and got on an anxiety medication, and it just changed. It just changed everything. I felt like myself again. So I just want to normalize that sometimes medication is needed, and even if it's just for the short term. I was on it for about a year. So that was kind of the story with my daughter. And then when my son came along, I had had a mastectomy and cancer the year before, and so it was like, I was going into this pregnancy, again, very, very thankful to finally have another baby. But it was a struggle to nurse. With one side, I had supply issues, that was depressing for me. I felt like a failure, that I couldn't feed him like I could my daughter. He was colicky. My daughter was not colicky. Now I know what a colicky baby is. Like, it is so, so hard. He was colicky until 4.5 months, and I didn't like him. I did not like him at all. I was going through the motions and taking care of him, but I really, really didn't like him. And I had a counselor at the time. We were talking through a lot of things. We went back and forth about whether I would do medication again. I was really trying to push through it. But eventually I think I got to the point where I didn't want to get up anymore. I was just done. I couldn't handle having the 2 kids. I just couldn't do it. And so I talked to my doctor about going on medication again, on a different one, because I had some side effects from the first one, and it's what I needed again. A combination of my counseling, the doctor, friend support, getting out and exercising, getting outside. So it takes a community to help somebody through. But anyway, that's kind of my stories.
Thanks, Teresa.
So I've got an 8-year-old and a now 1-year-old. So with my older, I didn't, have any depression or anxiety. So then, and then it took a long time also to have my now 1-year-old Atlas. So we had a couple of miscarriages, and we went through a few years of infertility treatment, and so I was very surprised when I was pregnant with him. I just started feeling awful, and like I was like, why am I so unhappy? I should be so thrilled right now. So that was a little bit of a shock. So, and I didn't really even know that like perinatal depression was a thing. I kind of thought it was like something that started like that day you give birth. Turns out that's not true. So yeah, I was really, I guess like I was due in January, so like through the fall it was kind of getting like worse and worse. And the weather, like everybody knows, doesn't help. And it was actually really hard to talk to my doctor about it. I like worked myself up like twice. And then like the third time I was like, I can't leave this office until I say something. And so I did, and I was like, well, I don't want to like do anything about it, but you know, like just so you know, like if it gets worse or whatever. And he was really nice, and he just, you know, talked me through different options. And so I went home, and it was, you know, I was just feeling like so overwhelmed, and like all of my negative qualities were like blown up. Like just like anxiety about like the windows, like I don't like, it was like very like house stuff, and like everything was just like, I just felt so out of control. And so about a week later, I sent him a message, and I was like, okay, like let's try some medication, because I just don't want to feel like this. And so I started a medication then before I had Atlas, and it took a few weeks to see any difference, but it did really help. Like it just, I no longer felt like a failure all the time, and like just so overwhelmed by life. Like I would have like, it was just really hard. Like I would get like an email from the school, like, oh, you need to schedule a parent-teacher conference, and I would like cry because I just felt like I cannot handle another thing, which is not, you know, normally I wouldn't feel like that. So, so the medication really did help, and then by the time I had him, I was in a much better place, so that was great. I stayed on it, they recommended staying on it for like 6 months or so after, and then I did start to come off of the medication, and I felt terrible, so I went back on, and I'm still on it. He just turned a year recently. So yeah, that was really helpful. I also saw a counselor to talk about, I just had a lot of anxiety about leaving my job. That was like a focal point of a lot of my anxiety. And so I was able to talk to her a lot about that process, and that's been really helpful too.
Before someone starts crying.
I'm Ashley. I've got 3 kids, 4.5-year-old, 2.5-year-old, and a 6-week-old. With my oldest, it wasn't until he was like 6 months. He was born in June, so like all through summer was fine, and then once fall, winter, crummy weather hit, that was like when it really was bad. And kind of similar to what you said, it took like a lot of courage for me to like get up and talk to my doctor about it, but went on medicine for 6 months and definitely helped. And then when my daughter came along, it did not have it as bad, but yeah, our first was a bit of a struggle. Just going from no kid to one kid was the challenging part, but yeah, just finding like a community and people to talk to about it definitely helped me. Now that I've got 2 and 3, knowing when like the triggers and things have definitely helped, so yeah.
I'm Katie. I we miscarried our first one late in the first trimester. I have then a 6-year-old, a 4-year-old, a 2-year-old, and in a month. My story started when my son was born, so my second born, who's 4 now. With my oldest daughter, I went back to teaching full-time 12 weeks in, so I think that kind of probably masked a lot of anything or just kept me busy enough to not think about it. But with my son coming, it was like the perfect storm. We had just bought a house, we were in mid-crazy renovation, like 3 months before he came. He was born in September, so the first really hard 6 months was in that fall, winter, and that's like seasonal stuff is a thing for me. I was home full time for the first time ever. Our 2-year-old was really, really hard. My daughter was really hard. And then we had a lot of breastfeeding issues. My flow was too fast, too forceful, and so anytime we had to feed, we'd have to lay on the ground. I'd have to lay on my side, and then he would be fine. And so I never bonded with him because I never held him. I couldn't hold him like a normal breastfeeding baby, and we couldn't go anywhere because I'm not going to lay in the library floor like, hey, there's a child. So all of it just was the perfect storm for that. But kind of how it manifested, it kind of was over time, and then it just was like, wow, there's a problem. But it manifested the most for me with paranoia. I was certain my husband was cheating on me and he was gonna leave me, and I had a plan for how we were gonna figure it out. I had numbers to call, and the poor man is just like, what? But I had all the evidence, I knew exactly why, and all the things. I'd have panic attacks where I'd have to pull to the side of the road before going over a bridge, over water, because I was afraid we were gonna drive into the water, and I didn't know how to get my kids out fast enough. Very on edge, very anxious. I was stubborn, and I didn't want to ask for help because I'm like, we're fine, we're gonna be fine, we'll get through it. This is not my fault, it's his fault, but it was all these thoughts that I believed, and it was all just part of this hormonal thing that was going on. Very irritable, out of body sensations, moody, delusional, all the things. And I didn't talk to my doctor about it until my husband and I were basically, to me, in my mind, we were 6 months in, and I was like, our marriage is over. That's just how it manifested for me, it was all targeted on my sweet husband. And so we went to this marriage conference, and I finally told my parents kind of about what was going on and all this, and my dad is also a family practice physician. He was like, there's something more going on than your marriage. This isn't his fault. And so we had to have this conversation, and essentially what happened is over time, when I started just recognizing things that, and I started talking about it. I started telling people about what I was struggling with and what was going on. And so people were speaking truth into that and pointing things out and praying for me. And, I was letting the light in a dark place. And the thing that really helped, I never went on medication. I was too nervous about all the side effects because I'm I already experienced all of those. I don't want to attempt to experience them more. And so I didn't do that, but I did stop breastfeeding at 9 months, which was, I should have probably a lot sooner, just given the situation we were in. And it was my whole world changed. I don't know if it's hormonal or what, or all the things, but my body settled down, my panic attacks stopped. I found a counselor for a couple months, and my husband, became a good friend again. Bless his heart. But I think it was a really dark season. I wrote a poem about it, but I don't think we have time to share. But just really scary. I had a lot of self-harm thoughts. I had ideas of how it was going to happen and who were going to take care of my kids. It was a really dark season. But like Ashley said, moving forward now, I can notice those triggers. I know when it's coming. I know that that's not true. I can speak to it a little bit more. And then when we had Asher, my third, I basically created like a battle plan. Like I emailed a couple close people and like, these are the questions you have to ask me anytime, at any point of this. And we, the Lord was gracious and we had our Asher in February, so the first hard 6 months was in spring summer when it was bright and sunny, we could get outside, and so all those little things it was a very redemptive season when my third was born. So praying over this one is also similar.
Thank you so much for sharing, please. It's really hard to get in front of a group and talk about something that's just so intimate, but we're so grateful for you guys sharing your stories. One question that I wanted to ask the group quick, and then I will open it up if there's any questions that you guys want to hear answered before we go into small group. But for those of us who haven't dealt with it personally, but we have friends who maybe have, or family members who have, what if there's anything that you can think of, what's something practical that somebody else did to help you through this season? I know it's like hard to think of maybe, but if any of you have things, whether it was your spouse or a friend, your parents, just like what was helpful to you for others to do?
I think some of the biggest things for me at first it was like taking a meal, like all those things was kind of nice, but I think, you get 6 months in and it's not as on people's mind to do things like that. So even just like showing up and being like, hey, I made a double batch of whatever here. Or, if you think of somebody, just do something. I think a lot of times people are like, well, how can I help you? And I'm like, I don't even know how to help myself. Like, I don't know, like just do something. So it could be anything from like bringing over flowers or chocolate or saying, hey, I'm going for a walk today. Do you want to come with me? Or I'm at the grocery store, do you need anything? Or dropping off of something for their kids to do. Like just random things as you think of that sweet person in your life. Don't ask, just do it, essentially, I guess, is because they're already probably overwhelmed or can't make a decision or something like that. And then, like texting them without questions. Because I feel like when I received texts that had questions in them, like, how are you doing? I felt this pressure and overwhelming to respond to them. And it was such a private battle that I didn't feel like I could be truthful, and then it was just, I get closed up. And so, even just like, hey, I'm praying for you today, or hey, I thought of you, this is a verse, or hey, just kind of basic, I ever obviously ask them how they're doing every once in a while, but just kind of really, when they're struggling, just those texts of, I'm thinking about you, you're not alone, I'm here, I'm gonna be at the park, no pressure, show up if you want, just stuff like that I think was helpful.
I did a really poor job of like talking to friends about it, but I did have one friend who I told, and she was really helpful because I was like, I know I should talk to the doctor, and then she would kind of be like, oh, did you do that yet? And it eventually did help. I was like, okay, I'm doing it today, ask me later. So just the accountability, I think, was really helpful for me.
Yeah, I think sometimes when you're in the midst of it, it's really even hard sometimes to make the phone call to your doctor because you have to do it during daytime hours, which is when, like, if you don't have kids that, if your older kid doesn't nap and then your other kid, it can be really hard to make just that phone call. I mean, so I had a friend come and take my older daughter to the library for a couple hours, and just having like time, just me and the baby was so nice, this was several months in, this wasn't newborn time, so yeah, I can remember that the whole first year parents need support. It's not just the first few weeks, but yeah, physical stuff, food helps. The other thing that I wrote down here is just words of encouragement, because I think a lot of us experience just the lies that our own minds are telling ourselves about how we're terrible at this, we're the worst mother ever, how could we think these things about, about our child, and so just continuing to speak like truth and encouragement over and over and over, so because you have to hear it from somebody else, otherwise you can't tell it to yourself, and just tell them like, you're doing great, and give yourself grace, like I don't, you guys can find the words for your friend, but just continue to speak truth and grace into their lives. And if you can, help them get outside, fresh air and exercise, whether that's like, I'll take your kids so you can take the baby on a stroller walk, or whatever it is to help them get out. Just don't leave them in isolation.
Yeah, I kind of piggybacking off of everyone else, but especially agree with like what Katie said, where it's like just don't just show up with a meal. Don't be like, I'm coming, or can I come over? Sometimes yes, that's probably what you should do, but yeah, I'd say just show up and offer to take older kids, or just, yeah.
Alright, and then really quick, was there any burning questions that you guys wanted to ask anybody on the panel or the panel as a whole before we go into small groups?
Not so much a question, but I just wanted to maybe put a thought that maybe you can speak on. Our husbands, they can also have postpartum depression, and if you think we're stubborn sometimes, the men can be even more stubborn to go to a doctor or talk to somebody. So, do you see that often? What's your advice on it? Maybe just speak into that a little bit.
Great point. Yes, men get postpartum depression too. So, first of all, speaking as a doc, I frequently see this amongst guys that like they've got that 3-month-old and they have that exhausted look on their faces. They're coming in from work and feeling pressures there and changes in family dynamics and such. I know that a lot of men have different touch needs as well too, and women's touch needs postpartum are different than men's touch needs postpartum, and often that can be very contentious. So that is something to work through. Yes, men get it frequently. I talk about that in when I'm counseling people in the hospital for sure, and encourage men. And in fact, I often tell men, hey, have you had a physical lately? And they're like, no, since high school. and then that's a moment that then they can follow up and be able to talk about those things. Speaking personally, absolutely I felt it. After the birth of our first child, I was in the middle of medical school. I was undergoing board exams, and if anybody is around people in medicine, it's a very stressful time during medical training, because it kind of dictates your ability to match into next programs and do next steps in medicine, so it's a very stressful time. And Henry was born right before that, and then there was some other family circumstances that happened that caused unexpected travel and things like that around that time. So I was just feeling very alone during that time and very stressed out, and definitely went through those times where I'm like, I am not enjoying this, and I'm not enjoying the work that I'm doing because I hate tests, and that was just a really hard time for me personally, and so I all in all, encouraging gently the men in your life to seek medical care, very reasonable. Remember that it's going to take probably 6 or 7 times of gently pushing on them to actually have change. And if it needs to be done sooner than several months out for that first introductory visit with your doctor, having them message or talk to people sooner than that is very reasonable. Anybody else want to speak to that?
Alright, anybody else? Any other thoughts before we?
Well, I don't know, that maybe we could talk one-on-one, or maybe you don't have anything, but, so I've never been pregnant, never given birth. We adopted our first daughter. I'm, Lord willing, going to adopt a baby girl, like, literally could be today, but for sure by Tuesday she'll be induced.
Wow.
So thinking from like the birth mom perspective, like we're hoping to have an open relationship, and so Christy will be birthing this baby girl that then we are going to bring here to live in Wisconsin. Like, have you worked with moms who are not going to be parenting their kids, or like have you ever, do you have any insights on like a birth mom who is then going through this and not having their child with them, or for an adoptive parent who, I don't anticipate having any of these things happen. I mean, I'm sure maybe they could. I didn't think about it until Ashley just mentioned it. Or like, I wonder if like that could be a thing. But I don't know, just any thoughts because this is your profession.
Yeah, thank you for that question. For those of you who didn't hear that, that was a question towards, in the sense of an adoption. I'm just gonna rephrase this to make sure I understand it as well too. In the sense of an adoption, what are things to look out for from a adoptive mom as well as how can we help birth moms? Is that the general question? So, from the adoptive mom standpoint, just all the things that come through with anxiety, depression, changing your family size, that definitely can ring true, even though you are not going through like the hormonal changes or things like that. Adding someone to your family is in the top 20 life events for stress. The first being the death of a spouse, second being like somebody going to jail in your family, and then there's a couple others as well, but definitely in the top 15, top 20. In addition to your family, whether that's an adoption or having a child yourself is an equal stressor. So yes, I think that a lot of those symptoms that you could have, especially like if like you're going through, my baby isn't taking a bottle, my baby hates the formula, spitting up all the time, weight loss, and then like you don't have like that. And some women feel guilt of like, I can't provide breast milk, or like if the baby is outside of the state, like, gosh, I wish that they could have a little bit more sense of connection with that mom. There can be a guilt there, especially like if you're gonna have an open relationship with mom, like, I'm gonna send beautiful pictures of me holding a baby and they have hurt and leaking breasts and just feeling all the postpartum things without the like benefit of having the baby to provide comfort through those times. So I think that just being sensitive of how much information do they want, how many pictures do they want, what updates are they interested in, that can be really helpful to just set that boundary for them of what level of connection do they need, because I assume that they're gonna go through like times where they're gonna feel really connected to that baby, and times where they like, I made this decision that I can't take care of this baby for a reason, and I just can't handle more updates about this baby right now because of how I feel personally. And that's nothing to do with like you as the adoptive mom, but that's just the hormonal shifts and just the grief process of going through separation from your child.
Thanks.
Does that seem reasonable?
Yeah.
Alright, anybody else? Alright, well, thank you all so very much. I'm gonna give it back to Katie in case she has anything else to say. One quick note, on your tables, there are pages that, so one of our next two meetings, either the next one or the one after, we are gonna have our lovely mentor